everyone. Welcome to another episode of Cyber from the Frontlines. In the last few months, we have actually seen an increase in number of cyber attacks on the healthcare sector. The most notable one was the attack on Change Healthcare in February of 2024, which was attributed to Black Cat, aka Alp-V ransomware scam. And this incident actually had a tremendous impact on both operational as well as financial risks for organizations that were utilizing Change Healthcare. So I thought today may be a good day to focus on the healthcare sector threat landscape. And to walk us through this, I am super pleased to welcome Errol Weiss to this podcast. Errol is the Chief Security Officer at Health-ISAC. Welcome, Errol, and glad to have you on this podcast.
Hi, Arun. Good to be here with you too. Thanks.
Thank you. So before we begin and talk about the healthcare threat landscape, I thought maybe it would be good to start with your journey in cyber. How did you get into cyber and where you are now?
Yeah, I think probably an early fascination with cybercrime in the late 1970s, early 1980s, if you can believe it was actually even happening back then. And then fast forward ahead to my first job right out of college, I started working for the National Security Agency, and I got really fortunate. I found a position later on in my career there doing penetration testing and risk assessments for government systems. So learned a lot during those days. There was a lot of on-the-job training. I was really fortunate to get that position, I guess, because of my natural curiosity, and the rest of it fell through for me. So it fell into place for me. So shortly after NSA, I found myself doing consulting services in the early days of the internet. So just online banking was starting to become a thing in the mid 1990s, and I left NSA and I was doing consulting services. Spent some time at SAIC, and when I was there, the idea about the ISACs themselves was born at the same time, with Financial Services ISAC going operational in 1999, and I was there for that time as well. A little after that, I left the consulting services and I joined Citibank, and I was working on the InfoSec team there. So I was doing some various InfoSec related positions, and then fell into another job that I loved, which was creating and then running our cyber threat intelligence organization across the city enterprise. So that was pretty fascinating.
Right.
You know, if you can imagine delivering threat intelligence for hundreds of thousands of individuals across 160 countries, I think they were in. And by the time I left there, the team was 40 people in about 7 different countries. So it was a really neat operation.
Very nice.
And then a few years later, found myself here at Health-ISAC. So been here now 5 years.
Awesome. That's good to know. And I also believe like if you start in the government, it's really helpful because you learn a lot when you start in the government. Uh, Especially with cyber, you get to know a lot of different systems and different things uh, that you can pretty much use later in your. It's really neat.
Yeah.
Really.
Yeah, just despite all the bureaucracy, I think that there's just enormous amount of opportunity in positions like that. To your point, and I think I was really afforded some wonderful opportunities, and it really enhanced my career.
Nice, really nice. So, so you mentioned you are now at Health-ISAC. So, if you could just tell us more about Health-ISAC, some of the listeners of this podcast may not be aware of what Health-ISAC is. So,
Yeah,
good.
yeah, absolutely. So let's even just start with what the heck an ISAC is, besides the world's worst acronym.
Right.
So, as I alluded to, the idea about the ISACs started in the mid 1990s. And it was the result of a federal study that found that much of the critical infrastructure was owned and operated by the private sector. And again, put yourself back in the 1990s timeframe when the internet was starting to become a thing and online commerce was becoming so important, such an important part of the day-to-day life. Of course, we know what it is now. But at the time, as a result of that report encouraged the creation of of an ISAC, an information sharing analysis center, for each of the critical infrastructures. So think about finance, water, transportation, power, health, of course. And the whole idea would be that each of those critical infrastructures would create their own ISAC. And so, as I alluded to, finance sector was the first one in October of 1999. And Health-ISAC came along in 2010. So we've been around just about 14 years now. And then the whole idea, really, the way I would boil it down to just a very simple statement is the idea of an ISAC is really like sort of a virtual neighborhood watch program. And if you experience a break-in, an incident, some kind of a cybersecurity incident, the whole idea is you can take the information about that incident, share that information with your peers, much like if you live in a neighborhood and your neighbor's house gets broken into, you can learn about what happened and you can try to protect your own house, your own network from similar break-ins or vulnerabilities or threats. So that's really what the idea of an ISAC is. And they're all very different from each other. Obviously, we focus on health. We also produce our own threat intelligence every day. So we've got a team of threat analysts that are constantly looking at threat landscape, new and emerging threats, and producing reports about that. So pretty robust service on top of all of the sharing as well.
Awesome. And I can attest to the ISACs because I work in the financial services sector and we are a member of the FS-ISAC, and the amount of intelligence sharing and the information that is shared between different members of FS-ISACs is tremendous, and there's a lot of value add to your service because you get information from other members of the ISAC as well. Really, really, really helpful.
Yeah, and I always say it's also a great learning opportunity. You know, we talk about a lot about the professional development, career development earlier. I think that I learned so much by participating on these forums when I was a part of the FS-ISAC as well. I learned from watching others and learning from others as well, and you know, just great career enhancement opportunities just by participating.
Absolutely, and the number of working groups that these ISACs have is really tremendous in helping you learn new stuff. Awesome. So you mentioned about the report being generated by the Health-ISAC, and I was reading through that last week. Actually, it just came out a couple of days back. Really good report. So I was wondering if you could just give us some insights into the top threats you are observing within the healthcare sector, the top trends.
Yeah, absolutely. So yeah, whenever we talk about threat trends in information security, it's like we never have a good story to tell. It's never a feel-good story because it just gets worse every year, every minute. It's just absolutely mind-boggling how bad the threats are and how the threat actors, the bad guys, the cyber criminals continue to innovate.
Yeah.
Every day, right? So, so with respect to the annual threat report that you talked about, and happy to make a copy available for the listeners here as well. We did a threat survey at the end of 2023, asking professionals in healthcare what they considered to be sort of the top 5 threats that they were dealing with in 2023, and what they were thinking about in terms of what 2024 was going to be shaping up to look like. And so we look at all the inputs for that and essentially come together with a list of sort of the top 5 threats that the industry is facing. And so on the top of the list continues to be things like spear phishing and phishing attacks. Second one's ransomware deployments. You know, there's just so much ransomware happening every day. Of course, you mentioned change in healthcare in the introduction, and of course, we think that there was probably an element of ransomware happening there as well. So some pretty big cases there too. Number 3 is data breaches. 4 would be third-party and partner breaches. So again, that just goes to the interconnectedness and dependencies that healthcare sector has on third-party partners and business partners. And then the last one, social engineering, good old social engineering. So very non-technical, but yet still very effective today, and things that our audience is worried about.
Yeah, we within the financial services, it's kind of similar as well. Like you mentioned, third party is somehow just ramping up the threats from the supply chain attacks and things like that. But really, and social engineering, like the one notable one I could remember was the one from Scattered Spider within the financial services, how they uh, profile the organization before they actually then call the help desk to and social engineer their way into. Yeah, it's
Right.
pretty unique.
Yeah, and that's an example on the top of the list for us, right? As we sort of look in the current threat landscape, of what's happening right now, social engineering still high on the list, and scattered spider, definitely one of those. We talk about social engineering help desk staff still happening today,
Yeah,
very active. Yeah.
absolutely. So one of the questions on my mind was because since we are seeing a lot of attacks on the healthcare, do you think this is a targeted attack on the sector, or is it more opportunistic? What is your take on that?
Yeah, I'm gonna go with opportunistic, and just to share some of the data. So when we did our fourth quarter 2023 um, uh, report that we call Healthcare Heartbeat, it's sort of a review of current malware, ransomware events, and also some looks at some of the current emerging threat actors that are facing the health sector. And um, when we look back on all of 2023, we tracked 3,743 ransomware events um, against companies and government agencies in every critical infrastructure sector. So over 3,700 ransomware events across every critical infrastructure sector. If we just focus on the ones in healthcare, it's only 304. So 304 events again in all of 2023. And so, 8 to 10% of the attacks are really hitting healthcare. If you just pay attention to the media and the news stories, it seems like 100% of them are in healthcare. And I think it's understandable to see the media coverage, because when an attack hits a hospital, um, it becomes very personal for you and me and our families, right, and our friends. And we see hospitals being diverted to ambulances being diverted to other hospitals, patient surgeries and procedures being canceled and rescheduled, um, all kinds of patient inconveniences happening as a result of malware or ransomware that's taking down electronic health records and hospital IT systems. And so again, it becomes very personal and very newsworthy. And so that's, certainly explains why we're seeing all of that happening. But again, if I look at the data, it's only 10% that's hitting healthcare. And again, just from the history that I've got in the cyber threat intelligence space and the work that I did, for example, when I was back at Citibank, um, understanding the criminal infrastructure that's in place today and the specialization that exists in the field, these guys are very good about creating malware. They're very good at distributing it. They're very good at collecting data. Once they get ransomware in place, they're very good at figuring out who they have access to and how much they can get from that particular victim. So again, I think they're shooting out as much as they can and hoping for a victim. And then once they get access to them, then they'll figure out the best way to monetize it.
Got it. Got it. No, that makes sense because if we solely look at the data from a data perspective, definitely makes total sense. So in terms of the ransomware attacks that you saw on the healthcare side, uh, I'm assuming it was more like double extortion kind of thing. The data exfiltrated, and then they were encrypting the systems. So, what kind of? I was just curious. What kind of extortion tactics did you see these actors employing?
Yeah, another good point. It's fascinating and just so scary to look at the evolution here of ransomware. Probably starting 15 years ago when the criminal actors would go after people like you and me and scramble our family photos and the history of our family photos and ask us for like $500, and if I lost all my family pictures, I'd probably pay the $500 to get them back. And unfortunately, right, that behavior, that paying the ransoms, has just encouraged the threat actors to continue to do that, to the point where we're seeing today where they're going after large institutions and they're demanding multi-million-dollar ransoms, and they're getting them. And unfortunately, as we know, right, this just encourages the threat actors to do more. They're using Bitcoin largely to conduct the financial transactions, which essentially is untraceable in a lot of ways, and they're getting away with it. So, I think there's lots of things that we can do to address that, but probably for another podcast. So what are we seeing today? As you mentioned, double, triple extortion. So let's just walk through that real quick. Usually, I'd say in the traditional ransomware, the first stage is that they get malware on your system, scramble your data, send you the ransom note, and say, "Hey, Arun, if you want your family pictures back, you got to pay me some Bitcoin, and I'll give you the key, and you can unscramble the data, and you can get your pictures back." So that's number one. Number two is what we've seen recently also is that they're stealing a copy of the data. So on top of step one, they will now, if you don't pay, they will now threaten to release the data publicly if you don't pay. So that's sort of step two. And then on the triple extortion side, on top of 1 and 2 that I just mentioned, they're also targeting these companies with distributed denial of service attacks, so DDoSes, and essentially rendering the public website unusable for those customers until, again, that DDoS is over or the company agrees to pay. So we've seen those kinds of things. Now, some variations of the 1, 2, 3s, but we've seen a lot of that lately. Now, the new twist, which I think is really awful, terrible, that we're seeing in healthcare, is that if the company doesn't pay, or maybe they do pay, there's still a value here to the criminals, is the bad guys, the cyber criminals, are actually going after the patients themselves.
Yeah.
So they've got a copy of that data. And so there's been a couple of cases. There's a psychotherapy center in Finland from a few years ago that was targeted by a ransomware actor, and that actor, he released sensitive patient information. He's on trial right now for that. And actually, in opening statements here a couple of months ago, the lawyers for the prosecution found that several of those patients had actually committed suicide as a result of the files that were leaked. So it's really terrible, terrible stuff. And then the other thing that we've seen also here in the US is some plastic surgery centers and practices that were impacted by ransomware, patients being extorted and threatened to actually release before and after photos from those plastic surgeries. So again, you can imagine the sensitive nature of those pictures. Yeah. And really causing some very, even more pain and emotional pain for those people. So just really terrible stuff.
Yeah.
So again, if anybody out there thinks that the bad guys won't target hospitals, it's complete baloney.
That's what I was about to say as well, because you keep hearing these groups saying we are not going to target hospitals, we are not going to target Medicare and all that, but here they are doing things. Yeah.
Yeah, I think it's another one of those tactics that try to pretend to law enforcement that they're not going after hospitals. Try to cool the law enforcement chase against them. But again, as we see in practice, it's completely baloney. Yeah.
Yeah. Okay. So in terms of these cases that you saw, I was just curious. The initial access, was it more like a phishing, or was it exploitation of vulnerabilities? That the 0 days and things like that led them to get into the systems?
Yeah, I think the biggest weakness is probably on the phishing side and somebody clicking on something that they shouldn't have, and there's exposure with username, passwords, so access credentials that are being exploited to obtain access. Is probably a big one. And then to your point, I'm sure a close follow-up is failure to patch in a timely manner as well. So we know that there's like some really old vulnerabilities that are out there are still unpatched and still exploitable today. So that the criminals are taking advantage of.
Yeah, great. So moving on to the next topic that I had was more in terms of where uh, does cyber rank as a priority within the healthcare sector, because it's a totally different sector, focuses obviously on providing health services to patients, and cyber could go down through the cracks as well if the focus is somewhere else. So that
Right.
could be a weakness that these attackers are probably exploiting as well. So I was just curious, where do you think cyber security ranks in the priority, or is it getting better? Has it changed since all these attacks that we are seeing?
Right. Yeah, I think it's getting better. There's, I think there's a really interesting history, and I've been spending some time trying to figure this out and talking to others in the field, trying to understand what's happened literally over the last 30 years in healthcare and cybersecurity, and trying to understand why we are in the shape that we are in. And just as an example, and Arun, you're in financial services. I was there for a long time. When I got here to Health-ISAC in 2019, I was talking to a CISO at a pretty decent sized hospital system on the East Coast. And he told me that he was the first CISO that hospital system had ever had, and he'd only been there 6 months. And in 2019, I was thinking, coming from financial services, like, how could that be? Don't you have to have a CISO?
Right, right.
Isn't that sort
Yeah.
of a requirement? So that sort of sets the stage for this. And so I think what's happened, if I can reiterate some of the history here, if you go back to the mid 1990s, um, the digitization of healthcare records started to become a thing. Hospitals and large medical care centers are starting to move from paper files to new electronic health record systems. And then also at the same time, we see the government issuing regulation like HIPAA, so privacy regulations to help protect those medical records that are now beginning to become digitized. And I think what happened as cybersecurity started to become a thing, I think really the focus was more on privacy and not necessarily security. So there was much more of a compliance mindset when it came to protecting the data and not necessarily a security mindset. And there's a difference between compliance and security. And so, the story that I like to tell is actually when I was back to my NSA days, we were doing a penetration test of a system. And like every single one of our penetration tests, we were always successful. And when we were doing the debrief with the system owners, they basically threw their hands up in the air and they said, how could this be? How could you get in? We just passed compliance policy last week. So again, so they think that if their passwords are 12 characters long and they've done all these configuration checks in the boxes and they've got everything done, that they are secure. Well, again, we know that's not the case. So I think again that history contributed to sort of the budget prioritization in cybersecurity and healthcare. And so with those budgets now focused on compliance, not security. But now with the rise of ransomware, um, changing mindset, all of the media exposure that's happened over the last several years, some of these big incidents that have happened, we're starting to see that turn around. We're starting to see people focusing on the need for better cybersecurity in healthcare, and we're starting to see some increasing budgets. So a bit of a long story, but I think it helps set the perspective.
Awesome. That's really encouraging and good to know as well. So in terms of the threat actors that you observe, uh, if you could list some of them that you're looking at, we already know about Black Cat was one of them, and I see a lot of I see the same actors in the financial services sector as well. Lockbit, Black Cat, think Scatter Spider. So my question was more around the information exchange between different ISACs, like the FS-ISAC, the Health-ISAC, or other ISACs. So how often is the information exchange, and what is the process around that? If you could shed some light on that.
Yeah, absolutely. And I'll start off with sort of the one thing I hold against the ISAC founding fathers is the fact that we did create all of these separate ISACs across each of the critical infrastructures, because we are dealing with so many of the same cyber threats and issues like that. But I also see there's a lot of value in terms of the focus that each one of us has on our respective sectors. So we need that. So it'd be great to have a bit of both. But the sharing between the ISACs, I would say, is still not as good as it could be. And up until a few years ago, it was pretty manual, pretty email driven, and pretty much driven by the energy and passion of the individual analyst. So very personality driven, as you could imagine. And as people change, we might lose some traction, but hopefully we pick it up with somebody, some replacement that's got that same energy and passion that wants to share. So we're meeting on a regular basis, and we're having those telephone, Zoom exchanges with other analysts and whatnot. But I think the real boost forward that we had was probably about 2-3 years ago, with the realization that many of the ISACs were actually using the same platform to create and distribute alerts to our respective memberships. And that's Cyware's situational awareness platform. And the realization with that was that, like, hey, if I've got something in Health-ISAC that I want to share with the financial services ISAC, in the old days, right, I have to email them, and then they'd have to copy and paste it and stick it into their system. Today, using Cyware, I can actually click on a button and have it appear in the financial services ISAC instance. Those analysts can look at it and say, yeah, hey, that's something that we would want to share with our members, put it into their system. It auto-populates it all into the right fields. They can add some additional context to the FS-ISAC analysis piece and then publish it. So it saves a lot of steps. It saves a good amount of time, as you can imagine. And today we've got 21 ISACs, ISAOs, and a few different country certs that are actually participating in the system today. So we're gaining traction, and we hope to get more in there. And I think sort of the next victory we'll have is when we start sharing more substantial information and more incident information there as well. So I'll just give you an example, like with this change incident that we're all so involved with these days. Health-ISAC, we are early receivers of some of the indicators of compromise from that incident, and we actively shared those indicators through this system to the other ISACs once they became available. So it's pretty good system for us to do that with.
Awesome. And yeah, I remember I saw the report coming in from HSI through FS-ISAC, the report that you guys had shared, really comprehensive as well.
That's great.
Yeah, awesome. So hopefully the information exchange gets better and better as we are dealing with the same threat actors really pretty much, and we all take them down together. So it was really great speaking with you, Errol. I had a really good time understanding the landscape.
Good seeing you, man. Yeah.
Understanding the threat landscape within the healthcare cyber sector. Healthcare sector, and I will also upload with your permission, of course, the threat landscape that HISAC has generated.
Yeah, please do. That's great.
As and when I share this post. So it was really good speaking with you, and hopefully we could do this more in the near future as well.
Great. Good seeing you too.